Let's talk to the story now. Gift of the Givers was on site in Booysens in Johannesburg yesterday, assisting disaster management, Metro Police and ward councilors to deal with the fire that started late afternoon. About 400 shacks affected, displacing 2,000 people. Disaster management were efficient in putting out the blaze once the affected residents, or rather once the affected residents were settled in their dwellings. Gift of the Giver says it will provide mattresses, food, parcels, hygiene packs and stationery. We're joined now via Skype by the Gift of the Givers founder, Dr. Imtiaz Sooliman. A very good morning to you, Dr. Imtiaz Sooliman. Thank you so much for making the time.
Good morning to you. Thanks very much for having me on your program. Before you ask your first question, I'd just like to offer my condolences for Jackson Mthembu. I knew personally, and condolences to his family, to the community, to the government, to the ANC. A wonderful man, a great loss, very straightforward, very frank, very pleasant to deal with him. It's a great loss to our society.
Absolutely in agreement with you, a really great loss. Tell us about the work you're doing in Booysens. How's Gift of the Givers assisting those affected by the fire?
We're on site already right now as I'm speaking to you. Our teams are distributing support. The queues are already there. People are waiting in the line. We were there yesterday evening, right after 11 p.m., just consoling the people. They virtually lost everything. The fire destroyed everything. All the structures were flat on the ground. People then went to the halls, the women and children. But in this case, most cases, almost all cases, when it comes to fire like this, people don't really like to leave the site where the house was. They feel they lose the site. So many people want to stay on site. So we were there early this morning. We're already distributing hot meals to them. Water, they get very thirsty during situations like this. I'm providing blankets and diapers and baby porridge right now. The moment they get into their homes, and again, it's a new standard in our society that they come up very, very quickly. They build very quickly within the first 24 hours. Once they settle in their homes, we will then provide them with food parcels and hygiene packs because it's easier to look after them once in your own house.
Yeah.
We're giving them sleeping bags now, but we will add mattresses later on and new clothing. And of course, with school starting in around 15 days' time or just a little longer than that, we're going to provide stationery and uniforms.
What's the most urgent need?
All items that I've mentioned, food is required, water, clothing, they require new clothing. Please remember, we don't take old clothes. They require new clothing. They've lost everything. So any type of new clothing, food items, any, hygiene packs, toothbrushes, soap, detergents, any of those type of items, more blankets, we need more blankets, and more mattresses. All those would be of great value because there's a lot of houses to cover. There's between 400 and 500. Nobody knows the exact number. They're still writing the things down. So it'd probably be 500 families that need all these items, adding up to about 2,000 people.
Dr. Sooliman, do we know if there are any fatalities?
Fortunately, in this fire, there were no fatalities. But it's been great to hear that after a long time, we had no fatalities in a fire. And again, every year, New Year's time, we always have some kind of fire. But this one, fortunately, there were no fatalities.
I know it's no cause for celebration, but for a while now, almost a year, your major focus has been specifically on COVID-19 related situations. What are your COVID-19 considerations as you go into this particular situation?
Where in the Booysens fire you're talking about specifically?
Yes.
Yeah, this rule is very simple. It's a standard rule. Everybody has to make sure you are the social distancing, make sure you got your mask on, sanitize, and that's what we do in every distribution. This was the only fire, by the way, we responded to during COVID-19. We've done several fires throughout the year from the beginning since March 15. So we've been involved in many fires, even storms. The big storm in Amtata, they destroyed so many houses. Fires in Kailicha, in Nyanga, in Langa, in many other, in Philippi last week, in many, many places. We've been involved in the same situation. But we have to say a big but. As much as you try to keep the social distancing, because there's desperation, sometimes the rules get broken. People get too close to each other. People are worried that they will not get the items. And even when we're doing water distribution on a daily basis, you're saying the same story for almost 10 months. But you can't blame the people because they never know when the next water or the next parcels will come from. So as much as you try and as much as they try, in that human need of desperation, the margins get blurred.
Dr. Sooliman, give us an update of, you've touched a bit on some, all the COVID-19 related work that Gift of the Givers has been doing throughout the country, where there are different needs. And perhaps if you can also tell us about the cost implications, where we can make a call out to South Africans to ask for assistance.
Well, let's start off with the cost implication. It's huge. It's very, very huge. And because we're drilling boreholes right now, we're busy. Adelaide is a town that has virtually collapsed. None of the municipality boreholes are working. The only boreholes that are working, they are Gift of the Givers. We're hoping to open several more boreholes next week. We're busy right now connecting boreholes. Many other towns in the Eastern Cape require boreholes. So boreholes is a huge cost, and we need to do many of that. That's part of our COVID-19 intervention. Without water, there is no cleanliness, no hygiene, no sanitation, and of course there's no health. You can't take medication, and without water, the body will not survive. The next big thing is infrastructure. We've just renovated last week, you've covered it on your programs, our doctor's accommodation in Bishu Hospital, because we put up a 120-bed COVID-19 facility on site, but with more beds means more staff. And this hospital didn't have reasonable or decent accommodation. And every time the doctors came, within 24 and 48 hours they left because they didn't want to stay in the kind of accommodation. So on Monday, we just opened up a new facility. We're looking at opening up a second facility so more doctors can stay on site. Then a few weeks before that, just before Christmas, we opened up 2 wards, high care wards, 1 oxygen points in Success Hospital in Makanda. And earlier to that, in August, we set up a whole ward in Mitchell's Plain Hospital called the Frisia Ward. And that's a dedicated 60-bed COVID-19 facility, 1 oxygen points. We just added 18 more oxygen points. And in the second wave, it's been of huge use to the Western Cape province. We're getting calls from other hospitals right now requiring infrastructure changes to make themselves more safe, more clean. So infrastructure is another big thing. The need for PPEs is, again, the calls are coming from all over, and all the hospitals tell us the same thing. We have nothing. We need pulse oximeters, we need gloves, we need thermometers. We're doing that. Our biggest project in the last 3 weeks has been the delivery of CPAP machines. CPAP machines are machines that deliver oxygen at low flow or intermediate flow, between 10 liters and 30 liters. And that has been an incredible success throughout the country. All medical people are getting back to us and say, where was this machine? It's saving lives. It's so easy to use. We're opening more wards, putting more patients on these machines, and they don't use as much oxygen as the high flow machines. But while saying that, we're also rolling out high flow machines because those are also life-saving when the CPAP doesn't work. And then, of course, we've been giving scrub suits. Those are the reusable green jacket and pants that the doctors wear. A lot of call for that. And yesterday, we launched a new project called Hospital Heroes. In the second wave, what has touched the country and what has touched the medical profession is the massive loss of life of healthcare workers. We haven't seen so many medical people die so quickly in a day, 8, 10 in a day around the country. And just to honor them, to acknowledge them, to encourage them, to motivate them, to make them feel good, we launched a project where we buy simple stuff which they can afford easily. A chocolate, a bottle of water, a juice, a cake, a kusister. But the impact that it had, starting off in Somerset Hospital yesterday, was just too huge. It's about emotional, psychological support and satisfaction and encouragement.
Sometime in the future, we reported about a disagreement talking about your water provision interventions. We reported about a disagreement you were having with the Makanda municipality in terms of how you were trying to help with water provision there. How are you finding your partnership with government in this rollout of COVID-19 interventions? Have things improved?
Look, it's a very strange situation. You get guys inside government who are not happy with what you're doing, and you get guys in the same department who are over the moon for what you are doing. It's a question of how systems work, how they do their policy, and and personalities. Within the same municipality, you would find some people. The problem is, to be blunt, is people feel they've been shown up because this kind of stuff should have been done by government, and should have been done a long time ago. Now, take Makanda. You raised a very important question. Makanda, the mayor called us 3 days ago. And he said, look, I need to make it clear. We have no money. I said, I know that from the beginning. That's why we got involved. But that's why when we spoke to you and your municipality, you said you'll get money from the National Disaster Fund, which of course never happened. And it was a 20 million project, which they were supposed to pay for, which we ended up paying for. But we didn't mind, because the people I need, and we're still there every single day, Monday to Sunday, with the water tankers. But coming back to him on 3 days ago, I offered him some time ago. I said, we'll drill 7 boreholes in Wainak. You guys haven't used all those boreholes. Now the town's got no water. All the boreholes are shut in the town. And we can fill the dam with those boreholes. So he said, look, the municipality will provide electrical connections. Can you reactivate all those boreholes? And this morning, strangely, I sent the instruction to my geologists and the water team to go on site to see if we can do that. And we've put 3 boreholes in the university in Rhodes. If we add all those 10 together, we can provide a substantial amount of water to the town. But to answer your question, yes, we do have a fantastic relationship with people inside government at ministerial level. We've got an excellent relationship with Minister Imtiaz Sooliman. We have a relationship with the municipalities, with the councilors. In between, of course, there's some people not happy with what we do. But I mean, at the end, when they see what we do, everybody comes to the party.
Talking about that excellent relationship you have with Minister Sisulu, are you using it at all to empower local communities? Because I'm thinking it's all good and well to bring in boreholes, but what about teaching whether municipal staff or local communities how to build a borehole from scratch, so they can find a way of sustaining these measures that you're putting in place to help?
Local communities cannot build boreholes. It's impossible. They can't do that. They can look after what has been given to them. Even municipalities, they have to look after what's given to them. Let's go to the process. You find a site, 50 people call you, the municipality call you, say there's no water here. Our geologist then looks at Google Map from a distance, from even 1,000 kilometers away. They can tell you where the water is. You will come there and then come on site. If there's potential, you will come on site. You are on site itself. There's different processes to drill, which communities can't do this. Even ordinary companies can't do this. You need to know the type of rock. You don't need to know where the fissure is. You don't need to know where the crack in the rock is. You know whether you need to know whether you have to drill 30 meters, 65 meters, go beyond it or stop. But the type of rocks that come out, you need to know whether they're water containing or not water containing. You need to know an electrical point. You need to know whether you need to put in Odex or other type of plastic PVC sheeting to protect the borehole so it doesn't collapse. Then you're going to choose whether you're putting electrical pump or solar pump. And then the most important of all this is how much water does the aquifer have? Communities cannot know that. If you take out more water than the aquifer have, the aquifer will get destroyed and the borehole will get destroyed and no one will have water. And sometimes you drill within the same aquifer a few meters away and put in a second borehole so you don't put too much of pressure. So those are all the kind of things you've got to look at. The community has to be brought in to say, please, we don't want vandalization. We don't want the pumps destroyed. We don't want you over-pumping. We don't want you stabbing the JoJo tanks when the water doesn't come out. We want you to be patient when there's no electrical supply. And now to overcome that, we look at solar pumps instead of electrical pumps because of the ESCOM situation. So those are all the different kind of things you've got to do. And again, practically in practice, where we found the water was running low and bowls were being overpumped by certain municipalities, we actually went back in and we reduced the flow of the water and told them, we lock in the pump. You cannot take water more than the aquifer can recharge and refill. It'll be a disaster for the whole town in weeks to come.
Yeah, noted. Are you able to give us some sort of, have you been able to measure impact in terms of the work you've been doing in the past year since lockdown level 5?
It's been massive. It's been absolutely huge. We got 400 boreholes that we put up over the last 2 years. Each one of them is functional. Each one provides water to between 1,000 and 3,000 people a day. Multiply that every day, for the whole lockdown period. We have water tankers in Makanda, Adelaide, Bedford, Graafrenet, and surrounding area. When Kerok is a difficulty, when Aberdeen or Janssenville is a difficulty, those water tankers go there and they have to neglect the towns that they're coming from. But it's an emergency. That's 600,000 to 800,000 liters a week, Monday to Sunday. We've assisted more than 200 hospitals and clinics with PPEs. That means masks, spray, K95, halyard, gloves, sanitizer, head cover, shoe cover, provided over 8,000 scrubs to hospitals, reusable surgical gowns, thousands of pulse oximeters and non-contact thermometers, video laryngoscopes, 2,500 CPAP machines, 76 high-flow nasal oxygen machines, and more coming out this week, plus infrastructure development, food parcels to 300,000 families countrywide. Each day, 6 people can eat for 30 days from that food parcel, 100 feeding centers. We put up 10 testing stations, 3 mobile stations, and besides that, we've done a lot of other things.
You started the conversation off by sending condolences to the Mthembu family. Has Gift of the Givers been impacted in any way by COVID-19?
Yes, we have. The last few weeks, last week has been bad. One of our staff lost his mother on Sunday. Before that, last day, December, one of my staff went to hospital for something completely unrelated, got positive in the hospital, didn't know was positive, came home, but fortunately, because we kept everybody remote, we didn't want our staff to touch each other, because if our whole staff gets infected, the whole organization can't function. And it's a crisis time. We can't afford to shut down. We've been working 7 days a week from the 15th of March up till now. We haven't stopped in December nor on New Year. So she got ill and she infected her husband, who also works with us. But fortunately, after 3 weeks, both of them recovered. On Sunday, one of our staff lost his mother. A day later, one of our, like you can say, semi-permanent volunteers lost his brother. His mother got ill, and now he is ill with COVID-19, but recovering. And yesterday, or 2 days ago, one of our volunteers, needed oxygen desperately in the Southern Cape, I won't give the area, but he's gone in. Fortunately, from a staff of about 90, those were the only difficulties we've had. And fortunately, no family members of the staff, besides what I mentioned, have been affected.
So the big conversation in South Africa in this year is vaccine rollout. Do you envisage that Gift of the Givers will be part of this process?
Many people have asked us that question. It depends if government wants a partner to roll it out. I've had medical schemes calling me. I've had big companies calling me. I've had individual people calling me. I've had doctors' associations calling me. But I need to be quite frank about certain issues. First of all, I'm a little worried. I'm not a scientist. I'm not a virologist, and I'm not a specialist on vaccines. But the part that worries me is that these vaccines were developed early, very early, when the virus came into the world. And I'm not sure if the vaccines against that virus is going to work against the new strain. There's a lot of discussion about it, whether it's going to eat the same type of protein or another site. Will it work or won't it work? Now, a lot of people are saying, let's take it either way. It may reduce the infectivity of the virus itself, but we're not sure. Given from the government point of view, the financial implication of bringing 60 million vaccines times 2 doses at the cost we have to pay, and we're not sure it's going to work. Are we going to lose money on something that's not going to work? Can we have some kind of surety, maybe a little more longer waiting to make sure that the money we're going to spend is actually going to benefit the population? I'm not against the vaccine. I'm fully for it, because in the long term, that's going to save lives. But also, the problem with that is if it doesn't work, people may have a false sense of hope. They are vaccinated, but are they immunized? That's the difference. They're vaccinated, yes, but have they got immunity? And there's a possibility if they don't get immunity, they can make their family members sick, and they can make their patients sick, because those frontline workers are the first ones that are going to get it. So are we absolutely sure? We have to have that safeguard, and we have that fine. Let's roll it out. Then the cold chain. Can we ensure the cold chain? What happens if vaccines are put in the fridge everywhere? There's no generator, and Eskom at short notice says we've got stage 4 load shedding. What happens to those vaccines if they're not properly preserved and they don't have generators in those hospitals? A lot of hospitals don't have the equipment, they don't have the infrastructure. Then we have a system to make sure that every person who gets his first shot knows when to come back for the second shot. Do we have a system, an app or a record system to make sure that there's no duplication or nobody loses out on the second shot? There's a lot of things to consider. And if all those things are in place, yes, we can help. We have a lot of networks, a lot of logistic capability, we can help. But these are the few things I would like to see straightened out first, and a clear answer before we get involved. As I said, we already asked why many people get involved. And the other thing I think government should reconsider is they shouldn't be the only people buying the vaccine. Because you're talking about a herd immunity of 40 million people need to get herd immunity. Are you going to get 40 million vaccines in 1 month? No. So by the time you get the vaccines for the other 39 million people, will there be a chance of herd immunity? You should open it up to people who can afford it, to bring it in and start Take medical aid societies. They've got 6-7 million people on their record, and they provide it at no charge to their members. Instantly, by bringing the private sector in, you can immunize 6 or 7 million people, which will help to get your target. It's going to take the cost of government. You don't have the money. Why waste time? Why don't you get the public sector involved? It will benefit, and then get the public sector to say, okay, we're very happy, we're thankful. We will fund 20% of the population who are not on medical aid and will give them free vaccine. We can have a mutualistic relationship where corporates and the public get in, and there are people who will be able to pay for 10 or 15 vaccines each. And we can use that collective bargaining to get the vaccines quickly, to immunize more people faster.
Dr. Sooliman, you've been at the coalface of the fight against COVID-19, and I know I'm asking you to speculate here, but have you been able to get just a sense of the impact of the reprioritization of funding of public hospitals and taking those funds to the fight against COVID-19? Have you seen the impact of this activity?
Yes, there's been a massive impact. If I understand your question correctly, money has been diverted. Remember, if you look at corporate CSI budget, the number one target on the top is education. That's number one. Disasters are low down the chain. They're not at the top. But with COVID-19, and even health is not number one, it's low down the list. With COVID-19, there's been a major shift of funding towards the pandemic itself. And we need to understand, in this case, it's not about, is it good for our company? Is it good to check the register or tick the register? We're doing it for public image. It's not about public image. People are scared. And people are scared, and they want, because they've had personal experience of people dying in their families and in the communities. So corporate CSI managers, the CEOs of the companies, the staff, and everybody else wants to do something that will prevent loss of life and will prevent spread of the virus. Because if it spreads, suddenly your family may be affected. So money has been reprioritized towards funding. We've heard of corporates that have renovated an ICU, or they put up oxygen points in a certain hospital, or they put some beds somewhere else, or they put up, other companies came and put up field hospitals. People have done different things and used their budgets for that. But while using their budget for CSI, those are the same companies that haven't made no income. If you take the car industry, the sale of cars from 30,000 units a month dropped to 3,000, 2,000 units a month. What happens to the income? So on the one side, we got people wanting to give CSI money, and on the second side, they are not making additional income to give additional CSI money. And those people who are having top jobs, who could contribute, many of them have now become recipients. They need aid because they collapsed overnight. And a lot of NGOs, for them, NGO is an income, it's job creation, and they have the people at the same time. A lot of them have folded because the corporates have decided they're only going to work with 1 or 2 NGOs, not with everybody, not because they don't want to, but they just can't afford it. So overall, yes, there's been a major knock-on effect in terms of job creation, NGOs, companies, refinancing, prioritization of funding and resources. Everything is diverted to COVID-19. We were giving fodder for animals, and suddenly everybody stopped. They can't give fodder. There's no transport cost. There's no money. The animals can't be assisted. People come first. So like that, what happened about gender-based violence? What happened about old age homes? What happened about homes of disability? They're collapsing. There's no funding for all those things.
Dr. Sooliman, let's commend you once again for the amazing work that you're doing. And you said you're in Booysens now. Continue to do the wonderful work that you're doing. And thank you so much for speaking to us today.
Thank you very much. Appreciate it.
Dr. Imtiaz Sooliman is the founder of Gift of the Givers. In the last